Hi, I'm Simon from Anaphylaxis UK. Just a quick message from me. It's really important that we get more subscribers to this YouTube channel, so please do consider subscribing. If you like the video, I'm sure you will, please put the thumbs up. Also hit that bell to get notifications. Don't forget, please subscribe. Hi, Helen.
Hi, Simon.
Let me ask you, strip it back to basics. How would somebody know if their child has got an allergy?
Okay, so there's lots of different features that we look at when we're looking at whether or not someone has an allergy. And when you go and see somebody, hopefully with experience, there's going to be lots of features they ask you about. So, what are the symptoms that you're describing? What's the timing involved after exposure to the allergen, the thing you think you're allergic to, and whether this has been happening every time they've been exposed. So if I just go back to the beginning, an allergy, for people who don't know, is an abnormal response by the immune system. So it's when the immune system is doing something it shouldn't and reacting in an abnormal way to something that should be harmless, like, say, milk or grass pollen or cats. And then it sets up a fairly classical pattern of different signs and symptoms that can occur. Broadly speaking, there are different types of allergies. So we have one called IgE allergies and one called non-IgE allergies. And the IgE stands for immunoglobulin E, which is a type of immune cell. So the IgE allergies are generally the ones that most people recognize because they're the ones that are immediate and quite obvious. So they're the ones that produce hives, so a nettle sting type reaction, swelling, vomiting, tummy pain, diarrhea, possibly runny nose, runny itchy eyes, sneezing, and then in the worst case scenario, anaphylaxis with that one. And they come within minutes to an hour or two after exposure to the food, and they clear usually very quickly after exposure, so usually cleared within an hour or so.
So there we're talking about peanuts, egg, all the kind of ranges of foods. Whereas where would you put hay fever, pet allergy, dust mites?
So they're still IgE type allergies, so they still would produce symptoms, but normally just the sort of nose and eye symptoms. So sneezing, congestion, runny, itchy eyes, sometimes breathing difficulties with it, particularly if someone has asthma, it could be a trigger for their asthma. But it's the food allergies that tend to produce the gut symptoms. And the main causes are things like egg, milk, soya, wheat, fish, shellfish, peanuts, tree nuts. Those are the commonest ones, but as we know these days, there are more and more things that people are allergic to. So the IgE allergies are quite easy in a sense because they happen every time the person's exposed to the food, usually very quickly. But if there's ever any doubt about the timing, you should speak to a healthcare professional. And they can be tested for. So we can do skin tests if you're in an allergy clinic, or a blood test potentially by your GP. The other type of allergies, the non-IgE allergies, these are much harder really because they have quite an insidious onset, so quite a slow onset, and they can occur anywhere between 2 and 72 hours after exposure to the food rather than that immediate onset. So it can be really tricky to figure out, is this, what's going on here? And classically, they occur within the first few months of life often. So milk is a common one, so a cause of milk allergy, soya. So it might occur for a breastfed baby who suddenly has formula introduced, or it might occur at 6 months if this is the first time that milk products have actually been introduced, or you do sometimes get it in breastfed babies who are exclusively breastfed, but it is less common.
So what are the symptoms that are different then?
So the symptoms that you get with a non-IgE allergy tend to be very gut heavy. So you tend not to get you don't get hives and swelling. So we divide it into the upper gut and the lower gut. So when you're talking about upper gut, we talk about reflux. So you might see that with a baby because they might arch their back or be very unsettled with feeds. Occasionally they go a little bit blue around the mouth when they're feeding, and that should definitely be checked out. They're very unsettled generally. For the lower gut, these are bowel symptoms, so they tend to have lots of loose, frequent, explosive nappies that parents describe as kind of punamis that leak everywhere. They might have mucus in the stool, but some mucus is normal from a normal gut function. But if it was just covered in lots and lots of mucus, very watery, we'd be worried about that. If they're breastfed and have blood in the stool, that's a possible sign of allergy. And then sometimes they get what we call soft stool constipation. So they strain, and when they do go, it's soft, but they've seemed like they've been constipated getting to that point. They might get redness around the bottom. They tend to be really miserable babies. So it's worth thinking about, how long does your child cry for a day? Because we all know babies cry, and crying for 3, 4, 5 hours a day actually can be normal, especially in the younger, months. But if you're crying for 12, 14 hours of a day, not normal, often a sign the baby's very irritable. So we look at those gut symptoms. And then when we look at skin, they can just have these kind of rashes that are appearing that you can't quite get a handle on what's going on. So they don't tend to be hives, but they can just look very rashy. And they also can get eczema. Now, the eczema itself is definitely not caused by the food, but it can be very hard to manage while the food is left in. So what we're looking at is, if you've got really difficult to control eczema and several gut symptoms, then this might be a non-IGE allergy. And then the final kind of thing we look at is the respiratory system. So these babies tend to be quite congested and grunty and a bit snotty. But again, it wouldn't be the only sign of a non-IGE allergy. So we very much say that usually there are 2 systems involved. So maybe respiratory with some congestion and lots of liquid nappies, or lots of difficult skin rashes and reflux. So we're looking at 2 things. And if the baby has severe illness, then their height and or their weight may drop. But that doesn't happen in the mild to moderate illness, but it's still quite significant, because they're still going to have a very miserable baby with lots of symptoms. So it still needs treating, but it's only the severe end where the growth is going to be affected. So it needs checking though.
And the difference between that serious allergy then and anaphylaxis?
So anaphylaxis occurs with the IgE allergies, so those more immediate ones. And you often get anaphylaxis in conjunction, so together with some skin signs like hives or swelling. But there is a proportion of people who won't have any skin signs, so it's not quite so obvious what's going on, and they just get symptoms of anaphylaxis. And symptoms of anaphylaxis, well, everyone often knows about breathing difficulties, but they don't realize it has other features. So we look at ABC. So A for airway. So they might be coughing. The voice might go different, a bit like croaky, like you've got a sore throat. Tongue swelling and dribbling. B is for obvious breathing difficulties. So noisy, wheezy, breathing quicker. And C is for circulation or conscious level difficulties. So they might be, say they're dizzy if they're older. A young child might go floppy. And of course, if you had severe anaphylaxis, then you may collapse and become unconscious. But it doesn't happen with non-IGE allergies. So they're both potentially severe allergies, because IgE allergies bring with it the risk of anaphylaxis and therefore potentially, but thankfully rarely, death. And non-IGE allergies, whilst it doesn't have that risk of anaphylaxis, it does have risk that it will affect the growth of the baby. And of course, that in itself is serious. So both allergies are life-changing and affecting and need to be recognised. But the non-IGE allergies, because there's no tests that exist, it's much harder and often missed by clinicians and doctors for quite some time. So as families, they need to be thinking, what are the different things that my child has? And then sometimes taking that to your doctor and saying, I'm worried about non-IGE allergy because they've got this, 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 and this. And that will help remind the person in front of them about this particular illness, which is often not as well understood.